I'm happy to welcome all the participants of the conference that is devoted to a very relevant issue for our region. And this is the use of real-world evidence in the healthcare. Definitely, global practice shows us lots of perspectives of using this data in different aspects of drug supply, starting from the registration, then from healthcare technology assessment and the outcomes. Kazakhstan is doing first baby steps for the development of the system of real-world studies and analysis of this data. And in my short presentation, I would like to mention briefly where we're moving as Kazakhstan, what is our local vision about the real clinical data, which is collected beyond RCT, and correspondingly, what are the aspects of use of this data we see for ourselves in Kazakhstan for real-world evidence. So the sources are quite standard. So, for example, in Kazakhstan, we have a very good site to implement real-world data and to analyze this data. And this is development of the electronic recordings and medical information system. Also, we have some national registers that are existing for different diseases. And we also have a number of other systems with mobile apps. So the sources of real-world data are multiple from the position of electronic healthcare. They are quite developed, and the use of this data could be a very strong resource to support the decision-making from the position of entering the drug. And if we speak about Kazakhstan data, about the issues of reimbursement, which is important, which is also decision-making on the healthcare technologies decision. So, besides the data of randomized studies, we use this data and we can answer the questions not only about efficacy and safety, and we can comment on that and we conclude it because we have it also in the format of RCT. But in general, we can analyze it through the prism of pricing of potential drug that we study in the real clinical practice. But again, even about the issues of efficacy and safety, the format of real clinical practice allows us answer additional questions that frequently are beyond the randomized clinical trials that are frequently limited with the pool of patients, with the selection of the patient, number of patients, and also duration of the study. That is how the real-world studies allow us to get more extended palette of data, looking at effectiveness in the real practice beyond randomized trials. And this is a longer period of follow-up, a more diverse population, how it can change the source of the disease, keeping in mind real practice, also compliance of patients to treatment, which matters, and again, the response of patients depending on the compliance, etc., etc. The same refers to safety. And definitely, from the position of activities that we are having. So this is National Center for Healthcare Development. This is national level center for the healthcare, and we're also resolving issues, the cost price, the pricing of technologies and drugs, and making decision about the reimbursement either by the state or by the system of the obligatory medical system in Kazakhstan. So this is the real data. So they play a big role because what is the influence of and presence of and resources, and what are economical and social potential advantages, and how economically effective could be versus comparators, and if there is any add-on versus current available treatments. I think in these aspects, RWE and RWD is of great interest for us, and when we assess this or that drug, we are planning to integrate this data for the decision making to our payers or the insurance or to the ministers, depending on the source of budget. Besides, the studies in the real world and real data allow us to answer questions about the patients. This is extremely important from the patient-oriented approach. So how it influences the quality of life of patient, improves the results, the outcomes which are important for patients, how patients are compliant to treatment, and some other parameters. So this is how implementation of RWE, RWD in the real practice will allow us to activate the analysis of the drug during the whole life cycle, as you can see it here. So as you can see, some data could be obtained from randomized clinical trials, and if we speak about real-world evidence, possibly lacking of this data is seen in Kazakhstan healthcare, because definitely innovative products are coming massively and not always coming to our market. Let's say if we speak about some orphan drugs, etc., or randomized clinical trials, definitely the real clinical practice studies. So it allows to, let's say, replenish some gaps that may exist due to the limited sampling and not enough data after the clinical trials when we launch products in Kazakhstan. Well, beside the data in the electronic systems, and I will mention briefly, because we understand that we need to get, more comprehensive data. These are observational studies and also other types of studies, and also historically controlled records. This is something what we want to use actively for the decision making, together with data of randomized clinical trials. But which aspects do we see here which are important for in general, and they are consolidated with the global and international approaches? So this is decision making on the real practice, and this is how it can be included into the national clinical guidelines and clinical protocols for diagnosis and treatments. Also, the issues of pharmacovigilance, we can analyze adherence and compliance of the patients, and then it will help us to make decisions and see the perspectives or advantages of particular treatments or devices, and then make conclusions about long-term efficacy and safety. If we talk about specific aspects in the healthcare technology assessment, the system which is already created in Kazakhstan and main center supporting the system, this is a center of healthcare. So these are things like the data of Kazakhstan population, which is most frequently seen, and this is what we see in the results of the randomized clinical trials, because the majority of the randomized clinical trials based on which we are making decisions are done beyond the territory of Kazakhstan and beyond the territory of CIS. Also, due to this data of real clinical practice, we can see another important point of using them in the specifications. So we can look at the comparative efficacy in the context of real conditions of healthcare in Kazakhstan. And definitely here, beside the drugs, we could assess also medical devices and the schemes of treatment in general using real clinical data and the healthcare programs. So our information system already have some initial sites for the development in clinical practice. Although there is always room for improvement, we need to continue collecting data and make the data available for the final user. And this is how we want to move here. If we talk about the using of real clinical data and creating approaches to the treatment of the patient, so I think these are realities which are clearly seen by our specialists in Kazakhstan now, and definitely the creation of clinical guidelines in our national Kazakhstan protocol would be very important, and mainly it goes by traditional way, and in the hierarchy of the evidence, mainly we'll look at systematic reviews and meta-analysis based on randomized clinical trials, although we also need to integrate this data of the real-world studies into the process of creation of in the format of clinical protocol. Yet, this data is used like fragmented, and there is no systemic approach to use them. I think this is a big focus. This is a focus site, and possibly we need to, digest it and understand how to use it in our approaches, to understand the place and the role of this data, and then to use it more actively in the design of the national clinical guidelines. So, what are the perspectives here from the position of our healthcare system? It is very clear that the real-world data becoming more and more important for the decision-making, for the players, for the regulators, and for healthcare professionals. And we want to see the same in our Kazakhstan system of the healthcare, because these studies provide additional data beyond the format of RCT. And then finally, we can move to from efficacy to effectiveness, and then to have more comprehensive assessment of potential value of the drug or medicinal products. And definitely the advantages of real-world data, that we can get simultaneously data from several sources. These are registers and also additional pragmatic or observational studies, etc. So definitely in this context, we support the initiatives to create structures and guides at the level of the European Union. And I think this is really a very good initiative of St. Petersburg School of Clinical Pharmacologists. Our clinical pharmacologists, let's say, will fully support this initiative, and we collaborate for quite a time with St. Petersburg colleagues, and not only with them. And definitely speaking about the real clinical practice, so that's a very good site for the very beginning of cooperation between Russia and Kazakhstan that we have in terms of data, because we have similarities of healthcare system, like in many countries of Eurasian Economic Union. And I think the transfer of this data should be seen. So what are the challenges in the integration? Definitely the quality of data. This is something we are confused by, because not all our information system and sources of data in the clinical practice have approach oriented on systemic approach. So sometimes sporadic order leads to some chaos and bias, and no systematic presentation of data, and definitely it limits the possible use. The question is the compatibility or matching in between different systems, because sometimes they are in a separate regimen. If we look at different electronic systems, they are very different. And until we have integration of all of them, we would never have the comprehensive picture. Definitely, this is an obstacle as well. So we need common platform for all information system and the vertical of data collection, starting from medical information system or laboratory information system up to the national level system. So this is approach that would help us to resolve this problem. So, starting from previous first parameters, we could speak about other parameters shown here. So, this is again usefulness of data, which we can get, and this is prediction of the beginning, and also prognosis of future incidence and prevalence, risk assessment, and keeping in mind multivariativity of data. And definitely what we need here is a better structured approach to the real clinical practice data collection, and then this data can be used in all processes that I presented in the previous slides. And from this position, we can make particular conclusions, both at the level of the regulator in the registration of drugs in Kazakhstan, from the position of a payer, where we can do this evidence, and then for the whole system of providing medical care in Kazakhstan. With that, I would like to thank you for your attention, dear colleagues. Thank you very much for this opportunity to speak up. And